Welcome back to Meds Made Easy. My name is Tarun. Today we're going to talk about Labetalol. I don't know what the brand name is. For as long as I've been in school, I've been out of school, I've been practicing, I've only ever known it as Labetalol. It's been a generic the entire time. From what I can tell, it's been a generic for a very, very long time. So it is used for hypertension or high blood pressure. Now, it is not a first-line therapy. First-line therapy is the first drug they put you on if you have high blood pressure. That is not the case. There are other medications you should be on that your doctor should have prescribed to you before you're on this medication. You're on this medication because one, it's not controlled well, or you didn't tolerate the other medications well. That's the reason why you should be on this one. Now, let's see here. It has alpha blocking and beta blocking activity. So it is a beta blocker as well as an alpha blocker. Now, with these Meds Made Easy videos, I don't like to really get into the science of it too much because most people frankly just don't care. But I'm just gonna kind of touch on this just real quick. So this works with two different mechanisms of action, right? So a beta blocker works by controlling your blood pressure, by controlling the pacing of your heart. So how boom, 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 how it, the rate of the heart is what it modulates, right? So in a high blood pressure state, your heart is probably pumping too fast. What this is gonna do is it's gonna slow it down. By slowing it down, there's less blood shooting through your vessels, hence less pressure, right? Now, the alpha blocking activity of it refers to the actual vasculature of your heart system. So your heart system, in the most basic way to put it, is like a plumbing system. If something gets occluded, if any of the vessels get occluded or blocked, then pressure starts to rise, right? So over the years of eating bad stuff, your arteries start to clog up, right? And it becomes smaller and smaller and smaller. Now, what happens when you're trying to push the same amount of blood through a vessel that's smaller? Pressure goes up. The speed of the blood has to be faster to move it so more blood can move through it, right? So what this works by doing is relaxing those blood vessels out in your vasculature to allow for an increase in the blood flow. Increase in blood flow without it going too fast causes a drop in blood pressure. And that's what we want. That's what we're looking for. And also over time, your vasculature, and this gets into a whole deep dive into the cardiac system and how your blood vessel system works, but they can also become rigid over time as well. So sometimes you do medications to force them open and things like that. So that's how it works. It's a very, very effective medication. We see it in practice all the time. Now, in terms of how you're going to take it, I don't go over dosing strategies and dosages just because every doctor is different. And I don't want doctors calling me up and yelling at me because you called them and said, hey, my pharmacist said this and now this is what's up. So you can take it once a day, twice a day. I don't think I've ever seen it more than twice a day. The thing about it is be consistent with how you take it. And I mean that with or without food. So if you're taking it without food every day, do that. Stick to that. Without food every single day. If you take it with food, that's fine too, right? But when you take it with food, it increases the bioavailability of the drug, meaning more of it gets into your system. And that's not necessarily good or bad, you just have to be consistent. Because if you're getting different levels in your bloodstream back and forth, it creates a problem. You want your bloodstream to have the same amount of drug at all times, right? We want consistency. That's what we want in medicine. And that's what we want in your body as well, consistency. Let's see here. The onset is anywhere from 20 minutes to 2 hours. You know, everyone's body is different. It reacts differently. So anywhere from 20 minutes to 2 hours when you start to feel it. It peaks, I believe, in about 1 to 2 hours, meaning the maximum effect of the medication is felt in about 2 hours. And then, let me see. And then the medication generally works for about 8 to 12 hours of activity, which is why you can go up to twice a day dosing, BID as they call it. It's pregnancy class C, which means as long as you've talked to your doctor and you've weighed out the benefits and the risks, it's generally safe to take. There is such thing called an RID, relative infant dose. And so you have to get your breast milk measured and stuff like that to make sure that there's not too much of the drug in your system. If it's below a certain threshold, you're totally fine. Above, not good. Too much is going into the baby. We don't want that. Liver renal issues, always make sure you're running them by your doctor. I know sometimes people use different doctors for different medications. Make sure everyone's on the same page on what you got. I'm gonna put up a list of side effects here. Again, it's tolerated very, very, very well. The things you kind of have to watch out for is kind of any GI issues, which is kind of true of any medication you put in your body, dizziness. And then there's this thing called orthostatic hypotension, which is kind of present with all beta blockers. And the best way I kind of explain it is whenever you get up in the morning, your blood pressure is usually is at its lowest that it's going to be all day. But if you quickly get up too quick, your blood pressure will spike and the medication will prevent your heart from being able to pump so quickly, and it causes people to pass out. It happens, so we have to always warn our patients about beta blockers, and that's only if you're on the really high doses. On the low doses it shouldn't, but man, everyone is different, so I don't want to say that it can't not happen, you know what I'm saying? So it can happen, so just watch out for that. So when you get up in the morning and things like that, or even if you're working out where you're doing workouts kind of like burpees where you're going down and up real quick, you need to watch out for that because it can cause those kinds of issues. So just be careful with those, be cognizant of it, and then adjust yourself accordingly. If you kind of feel a little bit lightheaded when you get up real quick, if you're jumping up and down, things like that, then you may be prone to orthostatic hypotension. And in severe cases, you can kind of black out and fall and hurt yourself, right? We don't want that. Guys, I think that's it with this one. Pretty easy, pretty not so bad, right? Leave comments, concerns down below. Give us a subscribe. Let us know how we're doing. We're just trying to help with these videos. Thanks, guys. We'll see you next time on Meds Made Easy. Bye.